morning or good afternoon, colleagues, depending on where you're joining us from. I see that colleagues are still joining. So perhaps let me give you a minute or so that we can have everyone on board. Okay, I think we should start our briefing for today. Let me welcome all colleagues who have joined us and those who are yet to join us for this Thursday morning briefing coming from the Africa Centers for Disease Control and Prevention, the Africa CDC. So this day, as usual, we will have the Acting Director of the Africa CDC, Dr. Ahmed Ogwell, taking us through and briefing us on the situation of COVID-19 and other public health issues on the continent. He will also be talking to us about some of the interventions by the African Union, which, as you are aware, was mandated by the African heads of state to safeguard the health of the continent. Dr. Ahmed will today also be reporting on the inaugural ministerial meeting for the Eastern RCC of the Africa CDC. So that's quite a lot in stock for us today. Today we have a different WhatsApp number for you to send in your questions to. So let me just quickly give you that number. It is, just hold on, let me just find it. Anyway, while I'm searching for that number, you can also come through live or send in your questions to the question and answer section. All right, I have that number now. Please do not use the one we usually use for these briefings, but instead use this number +251 904 139935. Let me give you the number again. It is +251 904 139935. So that's your questions if you want to use the WhatsApp contact, but always you can come through questions through the Q&A section. All right, let's now get to the briefing and invite the Acting Director of the Africa CDC, Dr. Ahmed Ogwell, for his briefing for today. Dr. Ahmed, it's over to you.
Thank you. Thank you very much, Madam Wayne, and good afternoon, good evening, colleagues, whatever. It's the 18th day of August. Our situation on the continent in terms of COVID-19 is as follows. We have so far documented 12,031,900 since the pandemic began, and this accounts for 3% of the total number of cases. We have also on the continent seen 11.4 million recoveries, which accounts for 95% of the total number of cases that we've seen here on the continent. We have unfortunately lost 255,754 individuals. A cumulative case fatality rate of 2.2%. And this accounts for 4.1% of the deaths reported globally. This 2.2% is, when compared with the global average of 1.1%, is still higher something that we would like to see come under control in the coming weeks and months. The top 5 countries have not changed, and they are as follows in as far as reporting of cases cumulatively is concerned. South Africa with 33%, Morocco with 11%, Tunisia with 9%, Egypt and Libya each with 4% of the reported cases here in Africa. Unfortunately, 41 of our countries are still reporting a case fatality rate that is higher than the global average of 1.1%. The same 2 countries, Somalia and Sudan, are still reporting a case fatality rate that is higher than 5%. During this week, when we look at the number of waves that countries have experienced, we see that we have now 27 countries that have reported a 5th wave. 27 countries on the continent have reported a 5th wave. We have 1 additional country since the last time that we were together, and that is Sahrawi Arab Democratic Republic has also reported experiencing a 5th wave. Only 5 countries have experienced a 6th wave, and they remain the same as we had last time. There are no new countries that are reporting a 6th wave. When we look at the situation of variants of concern on the continent, we do not see any change of any new variants from the last time that we had this briefing. However, I would like to give you a little detail, since there are some sublineages that are being reported to be increasing on the global level, and I would like to give you the situation here on the continent of Africa. From the beginning of the pandemic, we have sequenced 130,328 samples. Within the last 4 weeks, we have sequenced 6,004 new samples. From these samples, we see that currently the Omicron variant remains dominant on the continent, giving us 99% when we do sequencing. And we are keenly monitoring 2 sublineages, that is BA.2.75. No member states on the continent of Africa has reported this yet, but we are watching that it is spreading elsewhere in the world. We are also monitoring the BA.46, where 2 member states have reported this sublineage of Omicron, and that is South Africa and Botswana. So in as far as the sublineage BA.2.75 is concerned, we have not yet documented any on the continent, but we continue to receive sequencing data, and we expect that if anything changes, we will be able to inform you immediately. When we look at the trend analysis for the last 1 week, and that is epidemiological week 32, which ran from 8th to 14th of August 2022, and we compare it with Epi week 31, we see that the new number of cases during Epi week 32 is 11,836 new cases reported here in Africa. And this is a 29% decrease when we compare with the previous week. The highest proportions of the new cases are as follows: Northern region with 36%, and that is the highest proportion. Eastern region reported 24%, Southern region 22%, Western region 11%, and Central region 7% of the new cases. The highest numbers being reported from the 5 top countries are Tunisia with 1,894 cases during this week, Tanzania with 1,685, South Africa with 1,293, Zambia with 987 and 84, Zambia with 984, and Algeria with 887. But when we look at the new cases and tabulate them against a per million population, we see the following countries reporting the highest incidence per million population. Seychelles with 218, Sahrawi Arab Democratic Republic with 12, Libya with 10, Cabo Verde with 10, and Eritrea 2 with 10. During this AP week, a total of 81 new deaths were reported in Africa, which is a 19% decrease from the previous week. When we look at the trends over 4 weeks, that is 18th of July to 14th of August, the number of new cases, we are seeing a 30% decrease in the new cases reported over this period. And this is quite comparable with the 29% decrease that we saw for AP week 32. So during this 4-week period, the following is the breakdown. 24% increase in Eastern Africa region, 3% increase in the Central Africa region, 42% decrease in Northern Africa region, 15% decrease in the Southern Africa region, and a 2% decrease in the Western Africa region. So over this 4-week period, we saw those increases in Eastern and Central Africa regions. When we break this down by the most populous countries on the continent, over the 4-week period, we see Nigeria documenting a 6% average increase, Kenya a 43% average decrease, DRC 36% decrease, Ethiopia 16% decrease, South Africa 12% decrease, and Egypt there was no change. Over this 4-week period, when we look at the number of new deaths, we see that there has been an overall 22% average decrease, which is comparable to the 19% for the AP week 32. The trend is for a decrease in the number of new deaths as well as the number of new cases. When we look at the deaths and we break it down by regions over this 4-week period, we see that there was a 20% increase in the Western Africa region, 30% decrease in Southern Africa region, 18% decrease in Northern Africa region, 4% decrease in Central Africa region, and a 3% decrease in Eastern Africa region. When we look at it by the most populous countries on the continent, we see Ethiopia reporting a 64% decrease, South Africa a 28% decrease, and no change was documented in DRC, Egypt, Kenya, and Nigeria. Let's look now at the testing figures. To date, we have done over 121 million COVID tests on the continent. 703,000 new tests were done during AP week 31. This is a 27% increase from the previous week when we documented 554,000. So we are actually doing more tests during the last documented AP week. For this last AP week 32, we see that the positivity rate is now 2%, which is a decrease from the previous week of 44%, while the test per case ratio is now 59 for this AP week 32, which is a 78% increase when compared to the previous week. One country is still reporting a test positivity rate that is higher than 12% during this AP week 32. Let's look at vaccinations on the continent. We have received a total of 960 million COVID-19 vaccines in 54 member states here in Africa. We have administered 668 million, which translates to 70% of the total supply that we have received. The coverage for those who have been fully vaccinated on the continent is now at 21.95%. The top 10 countries have not changed. Here it is good to note that Sao Tome and Principe have shown an increase for the fully vaccinated to stand now at 44.8%. And Mozambique has also shown a modest increase to 44.2%. All the other countries remain the same as we reported last week. On facilitation by the Africa Vaccines Acquisition Task Team, as of 11th of August, 74,501,500 doses of the Johnson & Johnson vaccines had been delivered to 35 Africa Union member states. These are divided into the following three categories. Those that the member states bought and were facilitated by the Africa CDC Africa Union are 49,245,600 doses. Those that were purchased through the Saving Lives and Livelihoods initiative supported by the MasterCard Foundation are 17,899,200 doses. The US government has also made some of their donations through the AVAT mechanism, and the number of doses here is 7,356,700 vaccines doses. In the past week, we have delivered 468,000 doses of Johnson & Johnson vaccines to Sierra Leone under the AVAT mechanism. As we continue to increase vaccination rates on the continent, I would like to share progress with the Saving Lives and Livelihoods program. So far, we have launched mass vaccination campaigns in the following 5 countries: Ethiopia, Kenya, Lesotho, Namibia, and Nigeria. Mass vaccination is continuing with our support in those 5 countries. In the next round, and that is in a few days, we are going to be launching in the following countries: Burundi, the DRC, Liberia, Malawi, Tanzania, Uganda, and Zambia. In fact, on the September 11th, we are going to have a regional launch for the Southern Africa region in Lusaka in Zambia, where we will be paying special attention to the countries in the Southern Africa region, and we expect that we will be launching also several countries at the same time. But for the regional launch, it is going to be September 11th in Lusaka in Zambia. There has been, unfortunately, no further progress in as far as purchasing of vaccines that have been manufactured locally here in Africa, but we continue to negotiate and discuss with appropriate parties. When there is a change, we will be able to give you information regarding purchasing of vaccines that have COVID-19 vaccines that have been manufactured here on the continent. Let me now give you the situation for other significant outbreaks that we are also handling here on the continent. And I will share with you 5. And that is monkeypox in multiple countries, yellow fever in Uganda, Lassa fever, cholera, and measles, all in multiple countries across the continent of Africa. And let me start with the monkeypox. Since the last briefing that we had, 285 new cases have been reported on the continent of Africa, and 1 new death has also been reported during this time. Of the new cases, 31 are confirmed and 254 are suspected. This is a 62% decrease in the number of new confirmed cases that have been reported over the last week when we compare with the week before. 90% of the new cases that we have seen are being reported in Ghana and Nigeria. 5 of our member states are currently reporting new cases on the continent, and these are Ghana with 186 new cases, 13 being confirmed and the rest suspected. Also, they are reporting 1 new death during this week. Liberia has reported 22 new cases, only 1 being confirmed, the rest being suspected, and no new deaths in Liberia. Nigeria is reporting 75 new cases, 15 being confirmed, and no new deaths. It is worth noting that in Nigeria, it represents a 37.5% decrease in the number of new cases that are being reported from Nigeria. From the Republic of Congo, this is Congo-Brazzaville, 1 new confirmed case has been reported and no new deaths. While in South Africa, 1 new confirmed case has been reported, no deaths. And it is worth noting that the case in South Africa had a history of recent travel to a country in Europe. So cumulatively, we have this year reported 3,232 cases, including 411 that are confirmed and 2,821 that are suspected. Unfortunately, 105 deaths, which gives us a case fatality rate of 3.2% in 11 of our member states here in Africa. As Africa CDC, we continue to support countries with test kits. We continue to support them with capacity building. And only last week, we were building the capacity of 40 senior surveillance officers from 8 of our member states, not just for monkeypox, but also for other regional disease threats like yellow fever, COVID, and others. Our focus is capacity building so that each and every country that is at risk is ready to be able to identify these cases quickly. We are also quite pleased that nomenclature has changed for monkeypox variants, and we are very glad that now we can be able to call them Clade 1 and Clade 2, rather than make reference to these variants using African regions as a reference. We are very pleased with that change in naming, which will remove stigma from disease-causing variants. The second outbreak is yellow fever. This is only being reported in Uganda, in 3 districts in the central and the western parts of the country. To date, 6 confirmed cases and no deaths have been reported, and we continue to work with the Ministry of Health in Uganda through the Emergency Operations Center to ensure that we are monitoring the cases of yellow fever in that country and supporting them in community engagement, risk communication, and ensuring that our health workers in the affected areas are well updated in management of suspected cases. The third is Lassa fever, which again, we are reporting from multiple countries. Since the last brief, 182 new cases and 4 new deaths have been reported from Liberia and Nigeria. Liberia has reported 3 new confirmed cases, 20 suspected, and 3 new deaths. Nigeria has reported 159 new cases, 23 of which are confirmed and the rest are suspected, and no new deaths. It is worthwhile to note that for Lassa fever, these numbers from Nigeria represent a 70% increase in the total number of cases when we compare it with the previous week. So it is indeed a cause for concern. Cumulatively, though, from the beginning of the year, we have documented 7,154 cases of Lassa fever, 935 of them confirmed, while the rest are suspected, with 190 deaths, giving us a cumulative case fatality rate of 2.7%, being reported from 7 of our countries here in Africa. For Lassa fever, we continue to support the affected countries with diagnostics, capacity building, and surveillance so that we can be able to contain where new outbreaks are being seen. The fourth outbreak is cholera, which again is affecting multiple countries on the continent. Since the last briefing, we have documented 1,065 new cases and 14 new deaths for a case fatality rate this week of 1.3%. And these have been reported from Cameroon, DRC, Malawi, and South Sudan. From Cameroon, we have documented 18 confirmed cases with 142 suspected and 5 deaths, which gives a case fatality rate there of 3.1%. In the DRC, 830 suspected cases and 9 new deaths, giving a case fatality rate of 1.1%. Malawi, 38 confirmed cases and 2 deaths, a case fatality rate of 5.3%. And South Sudan, 1 is confirmed and 36 are suspected. No deaths out of those have been reported. Cumulatively, though, from the beginning of the year, we have documented 34,059 cases from 12 member states of the African Union, giving us 2,647 confirmed cases and 31,450 suspected, 495 deaths, giving us an overall case fatality rate of 1.5%. And these are from 12 of our member states. And to date, we continue to support these countries with strategic planning, with field activities. Indeed, for some countries like Cameroon and DRC, we are working with them to attain cholera elimination. The last outbreak I would like to share is measles. Again, this is in multiple countries. Since the last brief, 6,732 new cases with 42 new deaths have been reported across 4 of our member states as follows. The DRC, 2,614 suspected cases with 26 deaths. Ethiopia, 977 suspected cases and 4 deaths. Liberia with 1,526 confirmed and 1,586 suspected and 12 deaths, while Kenya has documented 29 suspected cases and no deaths. Cumulatively, from the beginning of the year, we have documented 169,172 cases of measles, including 28,750 which are confirmed and 140,422 which are suspected, with 1,542 deaths, which gives a 0.9% case fatality rate across 23 of our member states here on the continent. We continue to encourage our member states to leverage on the COVID-19 infrastructure for vaccination so that they can be able to reach the areas they need to control measles and vaccinate as many of the children there as possible. Finally, I would like to report on the Regional Steering Committee, a ministerial level meeting for the Eastern Africa region, the 14 countries in the Eastern Africa region, which was held in Zanzibar on the 15th and 16th of August, that is Monday and Tuesday of this week. The member states, the ministers from our 14 member states met and discussed very key issues around the health security agenda. Of note is that they picked Somalia to chair the Regional Steering Committee of Ministers and Mauritius to be vice chair. And some key items that were agreed upon during this meeting include that they will work towards full implementation of Africa's new public health order at country level. They have also asked Africa CDC and the regional economic communities in the region, and this is the East African Community, the Intergovernmental Authority for Development, IGAD, as well as the Indian Ocean Commission. These three regional economic blocs have been asked, as well as Africa CDC have been asked to work together to ensure that the new public health order is not only being implemented, but that the health security agenda is secured in the strategies and the plannings and the discussions and decisions of the various policy organs of these four African institutions. They have also decided that from here on, they will be preferring experience sharing within the region and within the continent, rather than going for meetings outside of the continent to discuss continental matters. And these are very key decisions that are going to change the way in which we prepare and plan for health emergencies and disease threats here on the continent. These are what I had for you today. And Wayne, I'm happy to take any questions if there are. Thank you.
Thank you very much, Ahmed, for that breakdown of all the issues and the developments. So for our question and answer section, perhaps let me just inform those who might have joined us a little bit later on that today we are not using the usual WhatsApp number, and instead we are using this number. It is a +251 904 139935. So that's the WhatsApp number for you to use today. So we go to the questions, and we have a question that's come through on the WhatsApp platform. And this is coming from Sarah Jerving, who is with Devex. Sarah says, why is the percentage of fully vaccinated people for COVID-19 staying around 20%? Why has there not been a significant progress in that regard? Ahmed, I think you're muted. Can you just unmute your microphone?
Yeah, thank you. Apologies for that. So thank you, Sarah, for that question. We would have wanted the percentage to be much higher than that. The reason why it is going up in modest amounts is because we are starting from very low figures. If you look at the vast majority of the countries on the continent, they have vaccination rates that are below 15%. So when you make a push for mass vaccination, the effect that it has is very modest because the original figure is quite low. Secondly is the fact that not many countries are doing mass vaccination. And this affects the speed at which we reach large numbers of individuals in a short while. But as we continue rolling out the mass vaccination campaigns through the Saving Lives and Livelihoods initiative, we do expect that over the next 2 to 3 weeks, the numbers will start inching up significantly because we'll be reaching more countries, we'll be reaching more individuals, and we'll be having higher average percentages in increased numbers of countries across the continent. So we are looking forward to that as well here, sir. Thank you.
All right, thank you. Let's go to our online callers, and we have Stella Rock. I don't know if it is Rock or Roque. Stella, you can correct me. Please just begin by telling us your news agency and then move on to your question. Hello, Stella.
Hello, actually, it's Paul Adepoju, signing in through Stella's account. Apologies for that. So I have 4 quick questions that I want to ask. The first one has to be your comments regarding the public health outlook, considering the outcome of Kenya's new presidential election that was recently held. What are your thoughts? Then Nigeria hinted that it will be rolling out rotavirus vaccination. How much difference do you see this happening? How much difference do you see this action impacting on rotavirus outlook on the country, and what suggestions do you have for other countries? Then monkeypox deaths in Africa. Do we have an insight on what is peculiar? What are the epidemiological insights for those that are dying of the disease? And lastly, you were those that responded to the poor participation of African countries at 2022 event due to visa issues. What are your thoughts about positioning African countries to be able to host these global events that are of more relevance to the continent? Thank you very much.
Sorry, Paul, can you just come again on your first question?
And even the second one.
Okay, the first question is, what are your expectations from Kenya's presidential elections that were recently held? What do you think should be the top priorities for the new incoming government? The second question has to do with rotavirus vaccination in Nigeria that was recently announced. What difference do you expect this exercise to have on public health outlook in Nigeria? And do you also recommend other African countries to aggressively also consider rolling out rotavirus vaccines? Thank you.
Okay, thank you very much, Paul. Before I hand over the floor to Dr. Ahmed, your first question seems to be requesting general comment on Kenya's new government, and that is outside of the scope of this press briefing. So I will ask him to respond to questions 2 to 4. Dr. Ahmed, it's over to you.
No, thank you. Thank you, Wayne, for protecting me from that first question. Important. Now, rotavirus vaccination, vaccines generally are very, very important tools when it comes to diseases, particularly vaccine amenable diseases like rotavirus. And we very much support the government of Nigeria's action to vaccinate against rotavirus. It is for us to carefully, we cannot do a blanket recommendation that all countries should be able to vaccinate against rotavirus. It is always a function of, is it of public health importance in a particular community and country, and then we can be able to make that recommendation for vaccination in other countries. But we encourage any countries where it is a public health of public health significance, then they do a vaccination. In terms of public health outlook, when you have a successful vaccination initiative for one virus or one disease, it always impacts positively on the next one, because members of the public then begin to appreciate the good tool that vaccines actually are, and also the need for them to be involved in vaccination whenever a vaccine is made available within their countries. So the impact of having a successful vaccination drive for one disease entity will definitely be positive impact on another disease entity that will be vaccine amenable as well. To your second question on monkeypox deaths, at the moment, we do not have information to share about the deeper analysis that we are doing on the deaths, because some of these are still being discussed with our member states. And so there is not much I can be able to say about that. Suffice is to say that the profile of those who are affected by monkeypox here on the continent does not reflect what other parts of the world are seeing. And we will see if we will have something more concrete to say about the deaths rather than about those who are affected. For the third question on positioning for global events, it's very important that Africa takes its rightful place, especially when it comes to public health, because we handle the bulk of public health incidences and outbreaks and pandemics here on the continent. We therefore need to ensure that whenever there is opportunity to host global events, we do so, particularly those that are related to disease entities that affect us in a big way here on the continent. In December, as you may know, we are holding the second edition of the Conference of Public Health in Africa in Kigali in Rwanda, and we are looking forward to participation from many delegates from within the continent and outside as well. So apart from positioning ourselves for global events, we also need to ensure that we are expanding homegrown events like the Conference of Public Health in Africa, and we are encouraging our member states to secure hosting rights for these global events. It makes life a lot easier for those of us who would like to travel because visa restrictions and things and cost of travel is then a better and more manageable. Thank you.
Thank you very much. I see Esther Nakazi has a question. Esther, good morning, and please go ahead.
Good morning, Winnie, and good morning, Dr. Ahmed. Thank you for taking my question. Dr. Ahmed, there are voices that if we had our leaders tell us to have mandatory vaccinations in our countries, just like they made us, have the, just like we closed down our movements and all that, it would have helped increase the amount of vaccinations that have been taken on the continent. So I just want to get your thoughts about that. If our leaders actually said we have to have mandatory vaccinations for all the countries, how would it have played out differently? Can I kindly get your thoughts? Thank you.
Thank you, Esther. Mandating COVID-19 vaccines is an option that has been discussed severally, but we need to think about several things around that particular pronouncement for any country. One is, do you have enough vaccines for everybody? Because if you mandate, you'll be mandating for everyone. If you have enough vaccines, then vaccine mandates would be easier to justify. Second, if you have the vaccines, do you have the infrastructure that can be able to take it out to the population quickly so that all of them can be able to get vaccinated? These two questions need to be answered before we talk about vaccine mandates. Having said that, you will recall that during the media coordination meeting held in Lusaka in Zambia, our heads of states during the discussions, His Excellency, the President of South Africa, President Ramaphosa, actually did call for consideration of vaccine mandates so that we can increase our numbers from 22%, well, that time it was even less, I think it was 17%, to 70%. Making that call energized our Saving Lives and Livelihoods program to start providing faster support to our member states in as far as COVID-19 vaccination is concerned. So vaccines mandates must come with the infrastructure of actual vaccines are there and the ability to be able to get it to the members of the public is also, that capacity is also there. You don't want to have a vaccine mandate and then you're not able to actualize that particular mandate. But it is an issue that has been discussed and we are looking forward to some consensus being reached in the coming months before we reach the end of the year. It does work if those two conditions that I've shared are met. Otherwise, if they are not met, it becomes difficult to have a mandate and you cannot be able to meet your end of the obligation.
All right, thank you very much. We don't have any questions that have come through for this moment, but perhaps someone is still curating their question. In the meantime, we heard yesterday about a possible case of monkeypox in dogs, in a dog in the United States. Could you just explain to us what this means in terms of the projection going forward in terms of the transmission of monkeypox?
No, thank you, Wayne. Yes, we have seen reports of reverse transmission, if you want, where humans are transmitting the virus to animals. Dogs and cats have been reported. This will change the dynamics of a spread of the virus. If the virus has gotten into the ability, have acquired the ability to be able to be transmitted from human to human and then from human to animal, it means then, especially domestic animals, it means then that the sources of possible transmission will increase, and this will be a very big concern for us because our efforts to try and bring monkeypox under control will face a challenge when you have multiple types of animals being infected, and those multiple types of animals being able to infect humans again. The more the sources of infection, the more challenging it becomes to bring it under control. And that is why for us, we need to galvanize the international community to control monkeypox by making available diagnostics, making available vaccines, and making available relevant resources for capacity building in communities and countries that do not yet have that level of capability. It's very urgent, and we support every effort that is going to improve the way in which we handle monkeypox before it starts getting even more clever ways of transmission between animals and humans and animals.
Judith Akolo, who is with the Kenya Broadcasting Corporation, has a question regarding COVID-19. She says, now that the positivity rate is below 0 in Kenya, can we possibly say that the 6th wave has ended?
Thank you, Judith. I think this is a question that Judith keeps on coming back with. I don't want to make a pronouncement that the 6th wave is over, but every indication, Judith, every indication is that if Kenya sustains the very low rates of transmission over the next 10 days or so, we can be able to call it off to say that the 6th wave is actually over in Kenya. I will give it another 10 or so days before we can be able to make that pronouncement. But the figures we are seeing from Kenya are very good because they are sustainably low. And this means that there is less and less of the virus circulating. And that is very good news for Kenya. But my advice at this stage, Judith, as you write and as you communicate with Kenyans and the authorities there, is the time to increase vaccination is now. So that if at all a 7th wave may come, you find many people have been vaccinated and therefore we avoid illness and possible deaths. When you find yourself at the bottom of the curve, that is when you increase your vaccination rate. So we really encourage the government of Kenya and all the partners that are working in the country to support the Saving Lives and Livelihoods initiative for mass vaccination, so we can be able to have as many Kenyans as possible vaccinated during this time when we are at the bottom of that curve.
All right. Let's come back to Sarah Jerving, who is with DEVEX. She says, what sort of media access will there be at the spaces for media at that conference?
Sarah, there will be a full media center at the Conference for Public Health in Africa at the Kigali Convention Center in Kigali. Journalists, all media colleagues are very welcome, all of you to be there for the that Africa is coming of age when it comes to organizing scientific conferences of this nature and of this scale. So media presence is invited. There'll be a full media center for all our journalist friends and colleagues.
All right, Esther Nakazi has come back with a second question. She says, can we have an update on the clinical trials in the DRC on monkeypox?
Thank you, Etsa. The clinical trials are still continuing, and we cannot be able to share any data until the trials are completed. The data is analyzed, and those who are responsible for the clinical trials then share that information. But it is good to note that the clinical trials are continuing, and we expect that as soon as they are completed, we'll be able to get the data, and hopefully the product will then be able to will be made available to the continent at commercial scale.
Second question from Judith Akolo with Kenya Broadcasting Corporation. Can we link the many zoonotic diseases and viruses afflicting human beings to climate change?
Thank you, Judith. It's very difficult to give a direct yes/no answer. But the more that we see disruptions as a result of climate change, the more that the humans and animals then interact in a way that gives the opportunity for viruses and other pathogens that are only in animals to then cross over into humans. So climate change is certainly a very high risk when it comes to zoonotic diseases crossing over into the human population. The more disruption we have within climate change, the more humans and animals interact, and the more the pathogens that the animals carry can then be able to be transmitted into the human population. And therefore, we need to make every effort to control climate change, while at the same time providing information to humans that we need to be careful the way in which we interact with the animal and the environment that we have not been interacting with before. We can pick viruses, bacteria, and other pathogens very easily. So in that way, climate change does contribute to closer interaction between the humans and the animals as a result of the disruption in our environment.
All right, thank you very much, Ahmed. I think we've answered all the questions coming from colleagues, and it is now time for you to round up with the main points that you would like them to take away.
Oh, thank you, Wayne. And I have 3 points today. One is around the COVID-19 vaccination rollout, the mass vaccination campaigns that we continue to roll out in countries on the continent. We need that supported by our member states, by our partners, by you, the media, by the public, so that we can get to 70% as soon as possible. The Saving Lives and Livelihoods initiative of the Africa CDC is in many countries on the continent. Let's support for success. Second is monkeypox. Although overall we are seeing a slowdown in the number of new cases, in some pockets in Africa we see increased numbers, and this is not a good thing. We are also seeing it popping in new countries. This is also not a good thing. We need international action, and this means we must make diagnostics, therapeutics, and vaccines accessible and available to all those who are affected, so that we can bring it under control quickly before the virus becomes cleverer and starts different speeds of transmission within the human population. Thirdly is, as Africa CDC, we are implementing the Africa Union Summit decisions, particularly those around strengthening regional action in close collaboration and partnership with our regional economic blocs. And in doing this, it is also in line with the Africa's new public health order, where we have partnership, collaboration, and joint action from our own member states here in Africa before we go out. In this way, we have already launched our regional steering committees at ministerial levels in the Southern Africa region and now in the Eastern Africa region. We will continue with the other regions. And as we do that, we will continue to implement the decisions of the Africa Union Summit so that we have more activities jointly with our regional economic blocs, with our member states in implementing the Africa's new public health order. I thank you.
Thank you. Thank you very much, Ahmed, for having been with us and for taking all those questions from colleagues from the media. So colleagues, this brings us to the end of our briefing for today. So we will meet again on Thursday at 12 noon East African time. Thank you very much. And thanks to Dr. Ahmed Ogwell and colleagues from the African Union and from the Africa CDC. Let's meet on Thursday. Bye-bye for now.
Thank you. Video.